Okay, Pearl, I'm going to start taking a look at your back. Just going to go ahead and put the hair up. Let's start taking a look at the curvature of the spine. Go ahead and sit as straight as possible. Okay, let's go ahead and imagine that you have a string that's trying to pull you up from right here. Okay. Notice a little bit of a decreased curvature right at the cervical area and a little bit more prominent right here, which is very common nowadays with the use of the phone. How many hours a day would you say you spend on your phone or on your laptop, kind of like looking down?
A lot.
A lot.
A lot.
Okay.
I work with both devices, so
if you would have to say 8, 9, 10 hours a day?
yeah, around 19 hours.
Okay. Is this kind of where it hurts the most?
Yes, exactly.
Okay. Go ahead and try to tilt your head towards your left. You're going to try to kind of touch your shoulder. Just stay there for a little while. Okay, go ahead and go neutral. Any pain right here?
Yes.
A little bit. Okay. To feel a little bit of tension in the TMJ joint. Go ahead and now tilt your head this way. Is that as far as you can go without lifting the shoulders?
Yes.
Okay. Just give me a few seconds to palpate the neck and the shoulder area. Do you feel like a pull, a stretch on this area?
Yes.
When you do this, does it hurt?
Sometimes.
Okay, go ahead, go neutral. Now you're going to try to touch your chin to your chest. Go as far down as you can. Okay, so right here, right by C5, C4, that's where most of the issue is. Does it hurt when you do that?
Not that much.
Not that much, okay. Now let's go ahead and you're going to try to look up, kind of tilt the head back as far as you can. Do you feel any pinching sensation, any sharp pain right here?
No.
Okay, go ahead. Neutral. Okay. Okay, so now I'm going to grab your hand. We're going to do the right hand first. Go ahead and try to touch the middle of the back as far as you can go. Okay. Any pain?
No.
Okay. Now we're going to go the other way. You're going to try to touch the middle, but going back. Okay, just stay there for a few seconds again. Okay, a little bit of tension right down the scapula. Go ahead and relax. Now we're gonna do the left arm. First up, okay, as far down as you can go. Okay. Any pain? No. Okay, go ahead and now you're gonna go down as far up. Okay. I'm gonna palpate right by the scapula. And the side doesn't seem to be that tense, which is a good thing. Okay, go ahead and relax. Okay, now go ahead and shrug your shoulders for me. Okay, now try to keep them like that. I'm gonna try to push down. You're just gonna try to resist my force. Okay, go ahead and relax. Okay, I do want to listen to some of your joints. I want to make sure that there's no cracking. Okay, you're gonna go ahead and lift your right arm. Just right there. Okay, now go ahead and lower it. A little bit. One more time, you're gonna lift it. Okay, lower it. One more time. Okay, lower it. Okay, we're going to do the same thing on the left side. Okay, back down. One more time. Okay. And one last time. Okay. Okay, now go ahead and try to bend your neck to the front. Okay, back to neutral. One more time. Back to neutral. Okay. Okay. So I'm going to be taking a few measurements. So I'm going to ask you to actually turn around. You're going to be facing the wall.
Okay.
I'm going to take a few measurements, trying to determine the symmetry. Your back. Okay. Okay, so we have here 1 centimeter difference. Okay, so we have 21 right there. Let's see if it's the same. It's pretty equal. Yeah, 21.3. That's pretty symmetrical. There is a little bit of inflammation, mostly on your right side, that's causing a little bit of symmetry. It's pulling on the shoulder joint, so this is a little bit shorter than here. Okay. And the area that I notice that's most misaligned is right from C4, C5, C6. It's an area of about 7 centimeters. Be taking a look at the skin. I don't notice any rupture of the fibers. Very minimal inflammation on the left side. Be checking the moisture content, which can be indicative of any fluid that's trapped and causing inflammation. Yeah, a little bit more prominent on the right side. Okay, that's it. Still not too concerning. Very light therapy and some adjustments can definitely help us get rid of this. Okay, I'm going to start by doing a little bit of traction. I'm going to be just pulling on the neck. I'm just going to be trying to elongate the spine. Does that hurt? Okay. Okay. Now I'm going to be pulling back. Pull back as much as possible. And we're going to. Okay. And back one more time. Okay. Now I'm going to be adjusting right by the scapula. I'm just going to pull right here. I'm going to be pushing your shoulder. Take a deep breath for me. Exhale. Okay, I'm going to be pushing right here. And then the shoulder back. Go ahead and take a deep breath. exhale. Okay. Okay. Now you're going to be joining your hands, both of them. Just go ahead and join your hands. You're going to grab them like this. Okay, very good. Okay, just going to interlace my hands right here. Go ahead and take a deep breath. Exhale. Okay. Go ahead and rest. Do you feel any type of release in this area?
Yes, it feels a bit better.
Okay. So now I'm going to be focusing on doing a little bit of massage, trying to target the deep tissue, around the shoulders and the back. We are going to be doing a little bit of suction cupping, trying to release that tension in this area. Okay, Pearl, I'm going to be tapping lightly on your spine. Just want to make sure that there's no neurological issue. Sometimes there can be a nerve pressing between the vertebrae that can cause nerve pain and nerve damage. So go ahead and let me know if you feel any sharp pain, any strange sensation like numbness, tingling, anything like that. All good so far?
Nothing.
Nothing, okay. Okay. Anything on the shoulder joint?
No.
No. Okay. Any pain there?
Yeah.
Any pain here? No. Okay. So now I'm going to be doing a sensation test. We are going to be using these two different sensations. This is going to feel dull and this is going to feel sharp. Did you feel the difference?
Yeah.
Okay.
Sharp. Dull. Dull. Sharp. 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 Oh, I guess that was sharp.
Okay.
Dull. Dull. Dull.
Okay, great. Okay, Pearl. I'm going to be applying a little bit of massage oil. I think this is last. Okay. Let's start by applying a little bit of pressure with this washer. I'm going to try to first target the deep tissue, release any fluid, try to release inflammation. Sometimes it's possible that you'll get some redness and it can even look like a little bit of bruising in a few days, and that's just a normal process. This technique is promoting the healing by rupturing the fibers into tissue. Did that hurt? A little bit, yeah. Okay. I'm going to be applying a little bit of pressure with this roller. This is a Himalayan salt roller, so it helps us promote healing, reduce inflammation. I'm trying to eliminate this knot. It's causing so much tension and it's not allowing your spine to align properly. I'm going to be applying a little bit of targeted pressure right alongside the spine. We're trying to help with the realignment of each vertebrae. And focus right here. This is where I want to go ahead and target with a bit more targeted pressure. very similar to the washout. It's a similar curvature. Now I'm trying to target the lower back, especially right around the scapula. Okay. Now we're going to be doing a little bit of skin pulling. You're going to feel it as a little bit of a pinching sensation. If the pinching feels like too much, let me know. We're just trying to release any tension that's trapped between the skin and the tissue underneath. Go ahead and wipe off the excess of oil. And to help with all that work that we've been doing today, I'm going to do a little bit of cupping. This is going to help us bring out some of that fluid to the surface. It works similar to the washout, where you might notice redness, you might notice a little bit of even bruising. But since we're doing a sliding cupping therapy, it's not going to be like the most common marks that are the big red and purple circles. Just adding a little bit of anti-inflammatory oil. This kind of facilitates the sliding motion. Okay. Now to finish, we're gonna be using the Swiss cup. This provides a very mild suction, so we can ease out of the cupping therapy. How are you feeling?
So much relief.
Okay. So I think we did a lot of work today. It might happen that you might end up being a little bit sore. So I would recommend over the next couple of days, if you feel very sore, you can go ahead and take some ibuprofen. It's going to help with any inflammation. But then after that, you should be feeling so much better over the next 48 to 72 hours. Okay? I also recommend you drink a lot of fluids, since we did a lot of deep tissue work, just to make sure that you can drain any toxins. Okay?